Of course, we all have stress in our lives, Carlos, as you know, but some people have very severe stresses like, as you said, a marriage breakup, a love affair gone wrong, a death of a spouse or even a parent or relative, death of a close friend, bankruptcy, financial losses, loss of job, perhaps going into the social media, having people say bad things about you. So any of those things can be very stressful and create a situation where it stresses your immune system to the point where your adrenal glands are producing more cortisone, and cortisone itself is immunosuppressive. So by putting you in that stressful mode all the time and your adrenals pumping out excess corticosteroids, your immune system is beaten down. So for that reason, yeah, stress is a factor. It's very hard to measure, obviously. There's no one thing you can measure, except you can measure random cortisol levels and things like that and see if those are affected by that. And there's so many different ways you can do it, just by prayer, by meditation, by Pilates, yoga, just a regular exercise routine sometimes is helpful. Massage, Reiki, any of those things, the energy treatments can help. So, and then with the proper diet, we're very insistent that they do the proper diet, and there's no single one diet for all cancer patients, Carlos. In fact, the most stringent diets would be something like the Gershon diet from Mexico, which is no fruits, no grains, only steamed vegetables, and lots of colonics. In terms of, they really overdo the colonics. They may, in fact, require you to do between 4 and 8 a day, which that's your whole day. I mean, you're basically paying attention to your colon for 8 out of 24 hours. Well, love itself is very energized. Just a touch or a hug from the doctor to the patient can be very meaningful, Carlos. It means the doctor cares about them and doesn't want to give up on them. Many doctors that I've known over the years and read about will tell a patient, get your affairs in order, go on that last cruise, make amends with your family members that you've had trouble with, write letters to your enemies, and these things. And basically, it's all negative. It's all, and patients focus in on that. So if you tell a patient you only have 30 to 60 days to live, they will die in 30 to 60 days because they start shutting down the systems. One by one, they shut them down. They stop eating, stop taking care of themselves, don't do the right diets, sometimes just go to bed and stay there.